an assistant professor. I'm an assistant professor with the University of Wisconsin-Madison School of Nursing, which is located on the ancestral lands of the Ho-Chunk Nation, a place that they've called Dejo since time immemorial. And I also want to just give gratitude to my co-chair, Dr. Claire Richards, who's here today and has been co-chairing the research forum with the Alliance of Nurses for Healthy Environments. And we are just delighted to welcome Dr. Nicole Thomas today, who is a postdoctoral trainee and a colleague of mine with the University of Wisconsin-Madison School of Nursing. And with that, Dr. Thomas, I'll just pass it on to you to do further introduction of yourself and your work and your presentation. Welcome.
Perfect. Thank you so much. Should I start out by just trying to get my screen up and going and sharing
Sure.
that? Okay. So that's got me a little stressed.
Okay.
Um, for those of you just joining, I was telling them I just had a huge snafu with one of my screens, and so I'm a little nervous that I'm not going to get to see presenter mode. But let's see what we've got here. Um, It looks like it's just taking a minute to load up. Are you all able to see
Yeah,
this
I see that it's
that
loading.
screen?
Hmm.
Okay, still loading. Okay.
Oh, I
And
can see it
then
now. Yeah, it looks
uh,
great.
okay, and what if I do this? Can you see my notes?
Yes.
Okay. That's what I was a little nervous of. Okay. Um I we might just have to let me just hold on one second. Let me see if this works. Sorry, y'all. I'm just going to try one more thing here.
I find Zoom does not give the user a lot of feedback about what you are seeing versus what other people are seeing,
I
and that's always
know.
been a challenge. I feel like there probably is a good answer out there, like there's probably tutorials and stuff that I haven't had time to look at, but I feel you 100% right
It's
now.
so nerve-wracking. Okay. Well, if we'll just wing it.
It's
If I
working
can't.
now. I think.
Now,
Oh
what
no, it's
about
popping up
yeah,
again.
it's
Yeah.
popping up again. Okay, all right. So I'm a notes taker in case, I mean, you all are seeing that right here, obviously. So I just finished putting these PowerPoints together or these slides together. So I tend to use my notes pretty heavily, but I'm going to try and work off of these so that I can get you guys the slides as well. As Jessica said, my name is Nicole Thomas, and I'm a postdoctoral trainee. And a clinical assistant professor here at the School of Nursing at the University of Wisconsin-Madison. And broadly speaking, my topic of research tends to focus on settler colonialism as a determinant of health, and looks at the impact of the embodiment of trauma of these settler colonial acts like dispossession of land and removal of children, but also how Indigenous culture can buffer adverse health outcomes from these settler colonial tactics. Today, I'm going to talk to you about the most recent scoping review that I worked on. It's a long title. So it's the health benefits of Indigenous cultural practices involving human interconnection with nature in for Indigenous peoples in the United States and Canada. But before we do that, I would also like to acknowledge the Indigenous scholars that I worked on this project with who are not able to be here today, who include Dr. Brenda Owen, who's a member of the Ho-Chunk Nation. Dr. Kyle White is a member of the Citizen Potawatomi Nation, and Dr. Lonnie Nelson, a member of the Eastern Band of Cherokee Indians. And I'd also like to recognize Dr. Angela Fernandez, a member of the Menominee Nation of Wisconsin, for her initial conceptualization of this project. So with that said, I currently reside in Madison, Wisconsin, like Jess said also, which is on the ancestral lands of the Ho-Chunk Nation. And I just always like to take a moment to acknowledge and offer my gratitude to the Ho-Chunk peoples. And just want to say that how thankful I am to be able to live and work and enjoy the beauty of the land and raise my child here. And also pay respects to elders, both past and present. I also like to extend these respects to the other tribes throughout Wisconsin. So this is the agenda. I'm going to take a moment just to talk to you a little bit about me, and kind of how I got here. We'll talk a little bit about a scoping review, what is cultural practices of human interconnectedness. We'll talk about the purpose of the review, the methods, and then the findings and the limitations. And if at any point anyone has questions or wants to stop and talk, please feel free. Um, please feel free to do that. I heard a colleague once say that they bring their whole work to um, their whole self to their work. And it really resonated with me because I feel like our work is really personal and intimate to our being. And I believe it's important for those who are interested in my work to understand some of my lived experiences and factors of my identity that undoubtedly impact my assumptions and perspectives that guide my work. And I think it will also help you to understand why I'm doing this work. I do tend to read off of my notes for this particular slide, only because it generates a little bit of just nervousness within me, and it's a more of like just an intimate storytelling moment. So I like to keep on track with that. So with that said, I've been a nurse for about 19 years, and I am the mother of my nine, she just turned 9 yesterday, 9-year-old daughter, Harlow. I am the granddaughter of Elvin and Violet, who are of settler ancestry from being of German and Norwegian descent. And I never knew my father very well, but I was always told that he was Native and was adopted into a white family, which I grew to know as my paternal grandparents. So I knew his adoption story and I understood my biological grandmother to be Native, but I never knew anything about her story. So I do not have lived experiences as an Indigenous person and was trained using Western methods as a nurse and an investigator. But to mitigate this, I have surrounded myself with Indigenous scholars, particularly with this project, who have helped to guide me. With that said, I also feel that it's important for myself to honor my descendants, although disconnected. I believe that that is a result of colonial forces surrounding Native adoptions. So I'm striving to be a good ally and learning how to support my Indigenous colleagues and communities. And my hope is to just help deepen nursing knowledge by using this role that I have and privilege as a nurse and a researcher to highlight Indigenous voices to help to educate and impact other settlers. So with that, we'll move on to the next one. So the purpose of this scoping review was to examine the relationships between engagement with Indigenous cultural practices of human interconnectedness within nature. That's really lengthy. It's a lot of words to say. So I'm gonna, from this point on, shorten that down to CPHIWN. So we wanted to look at these Indigenous cultural practices of CPHIWN and the key factors and characteristics of the health benefits and or the positive health outcomes among Indigenous people living in the US and Canada. And we really wanted to better understand if the research was being done, identify who's doing the research, what practices are being performed, what the reported health outcomes are from these practices, and what is needed to move this research forward regarding CPHIWN. So I know that there's probably, we're a diverse audience and we're all on our own trajectories. So I just want to take a moment to define and explain how we conceptualize and what we defined a scoping review as and how we used it. So a scoping review is a type of evidence synthesis that systematically identifies and maps the breadth of evidence available on a particular topic, field, concept, or issue within or across particular contexts. So what this really means is that this is a form of a literature review that uses methodological research to clarify key concepts on a particular topic and to identify characteristics related to that topic. So they're really great at being able to identify like what research has been done, and they're also great at being able to map what's available to ensure that we understand things like what outcomes are out there. How are things being measured, et cetera. And then in this instance, our concept of interest was, again, to understand what the literature says about CPHIWN among Indigenous people. And we really wanted to gain a better understanding of how the literature describes how human interconnectedness within nature is experienced through cultural practices. So I want to take a moment just to talk a little bit about what is Indigenous cultural practices of what is CPHIWN. The definition here is from Nicole Redvers, who I'm sure most of, if not all of you are familiar with. She is an Indigenous Canadian researcher. She's at the forefront of planetary health and climate change, and defines CPHIWN as this umbrella term encompassing cultural healing practices across diverse outdoor and indoor settings with activities involving direct engagement and kinship. With kin and relatives. So I'm going to use my notes particularly for this part. Kin and relatives are interconnected with CPHIWN through complex relationships and direct connections through kinship between kin and relatives. So via land, such as earth, waterway, and sky, and the more than human, such as animal, plants, and spirits. Indigenous people represent 574 federally recognized and 66 state recognized tribes, and they speak over 169 languages. And each tribal group engages in these distinct cultural practices that correspond to unique regional landscapes that involve CPHIWN. And it is rooted in Indigenous values, knowledge, tradition, spirituality, identity, and language. And these relationships with kin are really connected within nature and rooted in reciprocity and Indigenous ontology or ways of being, and Indigenous epistemology or ways of knowing. And the maintenance and restoration of kinship relationships within nature really is a direct pathway to strengthening Indigenous health and well-being. So we want to focus next on how necessarily is this achieved. So Dr. Kyle White is an Indigenous scholar at the University of Michigan and the author, one of the authors of this review, and is at the forefront of climate and environmental justice, and discusses the concept of collective continuance, which he defines as interdependence, system of responsibilities, reciprocity, and constant motion. So he talks about how relationships that are based on particular responsibilities of each party or relative that you have within a relationship. And these responsibilities refer to reciprocal attitudes and patterns of behavior that are expected by and of various relatives by virtue of the different roles that each may be understood to play in a relationship. So reciprocity is understood through this gift-giving and receiving relationship in which each relative has a special contribution to make. But to become a relative, one must be transformed into a relative with these reciprocal obligations. And transformation often occurs through ceremonies, and other formal activities. And Dr. White talks about how specifically the Anishinaabe kinship relationships are connected via these reciprocal responsibilities. And I'm going to talk about those for just a little bit. And the way in which these responsibilities are organized into independent systems facilitate this adaptive capacity of collective continuance. Additionally, it's important to note that CPHIWN is also viewed as essential for human and planetary health to flourish, and is known for having what is called co-health benefits. Let me get my notes for that. And the discussion of co-health benefits to more than human relatives is beyond the scope of this review, which focuses only on the health benefits to human health, but it's essential to acknowledge the mutual and reciprocal relationship and its role in sustaining planetary health, as it has since time immemorial, and is absolutely crucial to facing a future of the increasingly adverse effects of climate change. So one of the examples that Dr. White gave was of collective continuance was wild rice harvesting. And he talks about how wild rice harvesting is a sacred process across many Indigenous communities, as it's part of many communities' migration origin story, where they were told to go where the food grew on water. And so Dr. White explains that at this stopping point, they had to develop relationships with the water and rice as relatives, and they established a reciprocal gift giving and receiving responsibility that would support the lives of all the relatives, from the nutritional and ceremonial uses that the humans gained from the rice to the human stewardship and the protection of the rice habitats that rice gains from humans. And relationships such as these really help for the sake of identities, nutrition, environmental health, and many other reasons that we'll talk more about today. So while there is a growing body of Western literature on health benefits of nature contact, mainstream nature contact studies often do not include Indigenous samples, nor do they account for like the distinct Indigenous cultural practices, and certainly don't take into account typically the impact of these reciprocal relationships that we just spoke about. CPIH IWN is more than merely being in contact with nature. It builds connectedness, belonging, and relationality. And these factors are rooted in ceremony and love. And ceremony and love is protective medicine. It represents kinship, life, and this connection between all living things. And this reminds me of a saying that I once heard while I was in New Zealand at an Indigenous-centered conference from Indigenous Maori scholar Dr. Leonie Pihami, who said during one of her presentations, I'm sure many of you have heard this already, but she said, "To turn your head is to share your breath." And it just really spoke to me. And I looked up more to do with this sentiment. And it comes from one of the Suquamish leaders, Chief Seattle, where in one of his famous speeches, he stated, "All things share the same breath, the beast, the tree, the man. The air shares its spirit with all the life that it supports." And I just thought that that was really impactful. So to talk a little bit more about the specifics of the scoping review, our research questions are listed here. Those were: what Indigenous cultural practices are used for HIWN and have reported positive health benefits? And with which kin and relatives do these Indigenous cultural practices engage within the HIWN relationship? So we wanted to map how cultural practices used for HIWN were being reported to have these positive health benefits, but we also wanted to know if certain kin were engaged with more often. We thought that that might give us a good starting point to be able to do a deeper systematic review that could potentially then focus on how to create culturally endorsed practices, that could be used for new and innovative practices, or practices that Indigenous communities are already practicing with kin and relatives. So we'll talk about the eligibility criteria next. These are all the components of the eligibility criteria. So we used the PCC framework to identify and operationalize the participants, the concepts, and the context. So to operationalize the participants concept and context, we identified Indigenous people as the population of interest, which included any age, gender, and anyone that self-identified as a member of a federal or state tribal affiliation. They resided within the United States or Canada. And cultural practices were operationalized to include participation in cultural practices occurring within the context of nature, or when using a medium while participating in the cultural practice that originated as a natural being, such as sage or crystals. And it can occur in any setting and among individuals and groups, families, or community. With that, nature is inclusive or operationalized to be, for this review, inclusive to any place or location used for CPHIWN. So it can be indoors, it could be like at an urban park, could be in the forest. Wherever CPHIWN is being practiced. And then the articles must have reported on the relationship between CPHIWN and its health benefit. So we did a search in PubMed between April 2024 and May 2024, and then again in January of 2025. And these keywords and mesh terms were grouped into the 4 categories that we just discussed. And then the Boolean connector or was used to connect the terms within each PCC category, and then and was used to connect the concepts, the individual concepts to each other. So this is just to give you an idea, to give you a view of the terms that we use. This was the complete list of the search terms. So it was pretty robust, and we worked with our health services liaison librarian. And this is our Prisma outline. So as you can see here, the search retrieved 6,089 articles between PubMed and CINAHL. We had 2 reviewers independently screen the articles. We removed 2,544 duplicates, which resulted in 3,545 studies needing to be screened. So we did a title and abstract screening and excluded 3,496 studies, leaving 49 for the full text review. And then 30 were excluded during the full text review process, which resulted in the 19 articles that we'll be discussing today for this study. So the most common reason for exclusion was that there was no health benefit listed, or they were outside of the US or Canada. So this was the data extraction tool we created, and this is what we used for extracting the data. You can see here that we used it to gather information like the name of the first author, if the first author was Indigenous, their discipline, the characteristics of the title, like the year, the journal. We did look at the methodology. We looked at the location of the articles, the number of participants, but then really focused on the cultural practice, the kin and relative, the location on the engagement, the health outcomes, and or the health benefits. And then from this data extraction tool, we created our evidence table, which is what we hope to move forward with publication on. And this just is a good visual representation, I think, to kind of show you how we conceptualized how the relationship between the cultural practice, the associated kin, and the holistic health category related to each other. So in this instance, you can see that ocean voyaging related with waterways and sky, and it increased physical, mental, spiritual, and emotional health, whereas dog care, sled mushing related with earth and animals, and increased mental, emotional, and spiritual health. So we'll move on to this next one here. We'll talk about the characteristics next of the literature. This is an interesting table. Let me move this over here. So of the 19 records, about 75% of them were published after 2018. So that's giving us some indication that more research is being done. And 40% of the first authors identified as Indigenous. However, with that said, 45% also did not disclose their positionality. Lastly, the disciplines performing this this research spanned across many fields, such as medicine, social work, geography, and you can see the whole list here. And then of significance, only 2 of these articles were reported by nursing, one in the US that investigated the use of ceremonial tobacco, and the second from Canada exploring spirituality and cancer survivorship. This is just a visual of where the articles from the US were represented. So you can see here that they took place across Alaska, Hawaii, Arizona, New Mexico, Oklahoma, Nebraska, South Dakota, Minnesota, and Wisconsin. And then this here is a list of all the cultural practices that were identified through the 19 articles. So we had ocean voyaging, sled dog harem mushing, protecting sacred places, ecological reasoning or folk biological thought, harvesting and gathering traditional foods, traditional outdoor games, ceremonial tobacco, planting and gardening, engaging with sun and moon, beaver dam removal, any relationship with land, and then land reclamation. And so this next slide, I get questioned quite a bit about what ecological reasoning or folk biological thought is. So I took a moment just to explain it a little bit further because it was really interesting. So the title of this study was Cultural Differences in Children's Ecological Reasoning and Psychological Closeness to Nature, Evidence from Menominee and European American Children. So their goal was to examine whether 2 kinds of cultural concepts, 1, ecological reasoning, and 2, psychological closeness to nature, are available within the ages of 5 to 7 years old. So they felt that investigating cultural differences in this age group was important because it could tell how rapidly children's acquisition is shaped by the conceptions of their communities as they learn about the natural world. And they found that there are cultural differences in ecological reasoning and psychological closeness to nature between the Menominee children and the European children. So what they did was they conducted structured interviews in which each of the children viewed several pairs of pictures of plants and non-human animals, and they were asked how or why these species might go together. So like pictures of like raspberries and strawberries were listed. And they found that the Menominee children were more likely than the European children to mention ecological relations and psychological closeness to nature, and that they were more likely to mimic the non-human species, which I thought this was a really interesting article and worthy to bring up. So in the articles reviewed, we identified the specific reported health benefits, and we constructed 24 categories of health benefits based on all of the reported health benefit outcomes. So you can see the chart here. Those are all 24 health outcomes that were reported. And the overwhelming majority of the health benefits reported included improved relationships with people, community, culture, and land, and also improved identity, such as increased sense of belonging and positive self-change, increased physical activity, and overall holistic health. We did have some articles that spoke about specific health diagnoses, such as prevention of cardiometabolic disparities and metabolic syndrome and obesity. But most of the articles discussed an improved health outcomes as an overall improvement in holistic health. So these reported health benefits were then identified into categories of best fit for holistic health, which includes obviously the physical, emotional, mental, and spiritual realm. And as you can see here, by the chart, the areas of holistic health were distributed pretty evenly. So when trying to understand complex interactions, I tend to diagram the processes that I'm trying to conceptualize to deepen my level of understanding. So this is a work in progress. This is a model that I put together that's meant to describe the relationship of Indigenous cultural practices, of human interconnectedness within nature, holistic health, and then kin and relatives. And so it's supposed to show the interconnected relationship between how cultural practices are built within the realm of our kin and relatives, and how that supports the structure of our holistic health. It's definitely not meant to oversimplify a very complex process, but just a way to kind of start conceptualizing these very intricate and intimate relationships. So the purpose of the scoping review, again, was to summarize how Indigenous-centered literature described CPHIWN in relationship to health benefits. And we came up with 24 broad categories of health, and then mapped those to their holistic health domains. Other takeaways from the literature include how CPHIWN builds connectedness, belonging, and relationality. It recognizes that nature is viewed as a sacred entity, and it's deeply intertwined with spiritual beliefs and rituals. Along with that, ceremonies and rituals often integrate natural elements, reinforcing the belief that humans are part of the ecosystem, which fosters a deep respect for all living things. And the review demonstrated CPHIWN as a potential mechanism to sustain and improve multifaceted areas of health, most often improving and strengthening emotional health, physical health, mental health, and spiritual health. So the review did not seek to find challenges or facilitators for practicing CPHIWN, but some examples from prior literature reviews that we think may contribute to the intersecting barriers preventing access to and the revitalization of CPHIWN may include things like historical injustices, such as cultural erasure, having limited access to ancestral lands, that Indian Health Services is underfunded and doesn't have resources to cover CPHIWN for health benefits, environmental degradation, and that there can be limited accountability from healthcare and educational institutions. Despite having benefited from land, many institutions still do not fully support CPHIWN initiatives. And despite these significant barriers, although not all examples of CPHIWN are cataloged in Western literature, from an anecdotal perspective, we know that Indigenous communities do connect with their ancestral lands and perform traditional teaching as a source of wisdom and medicine. We do know that they are building cultural identity and that they are creating land-based healing programs, despite only having the 19 articles from this review. So when I was putting the manuscript together, I questioned how others and I could apply this knowledge. So although we didn't have a goal within this review either to identify practice implications, we thought it was necessary to discuss how this knowledge could perhaps be translated into nursing practice. So, first and foremost, we felt that we strongly believe that this work, largely being conducted at the local level, should recognize and honor the collective wisdom of the Indigenous communities in the surrounding areas. Additionally, learning about cultural practices that connect to the land for healing purposes should be guided by traditional healers and the Indigenous community. Um, and we also felt that nursing, being the largest workforce, allows for strength in numbers and the ability to advocate. So if nurses understand and represent and advocate that Indigenous knowledge and traditional ecological knowledge or tech guide CPHIWIN and are valuable assets that can enrich modern practices on climate change, environmental health, and public health. And lastly, it's also, we felt, imperative for nurses to uphold and defend the process of informed consent to ensure that policies affecting Indigenous lands and practices respecting Indigenous people and Indigenous people's rights and well-beings. So next, I just want to talk about some of the limitations to the scoping review. As I stated previously, I was trained as a nurse and an investigator using Western methods. And since I don't have the lived experiences as an Indigenous person with tribal identity, I relied heavily on my Indigenous colleagues to help guide this review to help mitigate this limitation. Second, although we wanted to include tribal house literature, we were limited by our resources. We didn't have the bandwidth to do so, but we think that had we had the bandwidth, this would have been a really rich resource to be able to procure some of this literature, but we're unable to do so. And third, much of the literature spoke about the overall holistic health and well-being, whereas in our search didn't really encompass the range of search terms to amply cover the concepts of holistic health and well-being. We know that there are growing amounts of land-based healing programs and initiatives. However, we either didn't capture these articles or these initiatives haven't yet been documented in a Western peer-reviewed article. And lastly, again, a challenge was from the search strategy itself, determining the synonyms and the search terms related to CPHIWN. We created a very robust set of terms with our librarian, but again, considering the focus on holistic health, these synonyms might not have been capturing the data we were looking for. So for next steps, we hope to be able to publish these findings soon. I'm just putting some of the finishing touches on a manuscript for this. Given the focus again on the literature talking about holistic health and well-being, we may do another scoping review looking more so at the relationship between holistic health, well-being, and CPHIWN. Another idea I thought too was we didn't even scratch the surface of talking about co-health benefits of our non-human relatives, and looking at those co-health benefits might be a good next step to go from here. And then lastly, I just started a grounded theory study that is looking to explore the process of forming cultural identity among urban Indigenous women. Oh my gosh, that puppy is so cute. The findings may help us understand if there's a protective effect based on a participant's meaning and action of Indigenous practices and culture for urban Indigenous women. And in conclusion, since 2018, we saw a significant increase in articles being published on CPHIWN. 42% of the first authors identified as Indigenous. We found that cultural practices are diverse and engage with kin across the earth, plants, waterways, animals, sky, and spirit. The review demonstrated CPHIWN as a potential mechanism to sustain and improve multifaceted areas of health. And more nursing research that brings in Indigenous voices and life experiences we feel is necessary to do better for increasing our nursing knowledge and providing culturally congruent care. That's just a brief look at the references, and that is everything that I had for you today. Go ahead, get back out of that. We can go back to this first screen here. Sorry about this. I just had this feeling in the pit of my stomach that that was going to happen. I'm so sorry that you weren't able to see the screens fully.
No, that's perfectly fine. It was an excellent presentation. Thank you so much, Dr. Thomas. And I put in, for those that joined a little bit late, I put in the chat that there'll be a recording of this, or this presentation has been recorded, but then we'll also have the full slides from Dr. Thomas so that
Yes.
you can always follow along with those
Yes,
slides
thank
if you
you.
couldn't. But you did a great job of like moving things around so we could see what you were showing and making like the key points and highlights. So
Okay.
yeah, thank you so much. That was an
Great.
excellent presentation.
Yeah, absolutely. Thank you so much again for having me. It was absolute honor to be here.
So at this point, we're going to stop the recording if we haven't already, and then we just have some time between now and the top of the hour for Q&A discussion. Um, and I see that there's Cyrus, did you want to say what you put in the chat here?
Just a huge thank you. I was saying that I've kind of just meeting a lot of these concepts simultaneously, and this really does a wonderful job of pulling them together. I do have to drop a little early for a childcare pickup, but I really look forward to digging into the materials and seeing how we can kind of raise awareness here at Emory. I think there are a lot of overlaps that have laid the ground. So thank you so much for this work. I look forward to seeing more of it.
Wonderful. Thank you. Thank you so much for that comment. I appreciate it.
Great. Thanks so much. Thanks for joining. Yeah, Erica, go ahead.
Thank you so much for this information. I particularly already looked up the article about the children and their perceptions of nature. I happen to have a child who I believe she was born outdoors, so it'll be interesting to look at that. Just
Yes.
a couple things. One, it looked like most of the feedback I didn't see. You talk about emotional health, spiritual health, but it looks like a lot of your work is around social health that you found. So I would just, that word I didn't see, and I particularly do work in psychosocial benefits.
Yeah.
I would just highlight that especially in the last 5 years. I mean, I know we're talking about 15,000 years of knowledge that is held so deeply. But that social aspect is so very important.
It really is.
With our youth. I work with environmental justice issues in Minneapolis, and our youth are really asking for, we're trying to create mentor programs outdoors and leadership opportunities and to connect kids with their environment, but also with their community, and so disconnected and so important. The other piece that I was wondering about, your slide that talked about the factors that were identified. So you have depression as one, anxiety as one, and it looked like that total, it kind of went quickly, but it looked like the total ended up to be 19. But I'm wondering if you did any mapping of, like, I'm certain they looked at multiple factors of, maybe well-being and anxiety, depression, social indicators. So just wondering if you did any mapping of pulling the multiple concepts that I'm guessing were looked at within each study.
Yeah, we did not. That's a really good point though, because many of these were many of these concepts were talked about within the domain of those concepts, so within one article, and we parsed those out, but I do see the value that would bring to be able to outline those characteristics when looking at the holistic picture, if that's what you, is that kind of,
Yeah, and I
yeah,
think that's the most difficult part of our work is that, you know,
it
we need
is.
to
Yeah.
silo things to measure it, but it really should never be siloed. It really
Yep.
has to be looked at as a whole. But we are in this scientific model that's so messed up in ways that we
Yeah.
pull people apart to be less than the sum of their parts. So I know that's, you know, a whole nother thing, but I so appreciate the work that you've done. Thank you for sharing today.
Yes, thank you. And thank you for your feedback on that. That's a really great point. And it's something like that I was it brings to light what I was talking about how these sometimes the Western perspective and Western scientific perspective can overtake sometimes the perspective of really what we're trying to do. So I appreciate you bringing up that point.
Okay, thanks so much for the comments. And I just want to say in the chat, Melissa had to leave, but she said she looks forward to your publication. So we'll make sure to highlight that also through Annie once it's published. So
Thank you.
yeah, go ahead, Claire.
Thank you, Nicole, so much for this presentation. I can really appreciate this given that we just published a scoping review, and so I know how much work goes into it. It's a tremendous amount of work, and I can see just the amount of different things that you had to look at from the point of what the intervention was and the population, the health benefits. Getting back to the health benefits, like one of the things in our scoping review that we were thinking about, because one of the sub questions related to Indigenous health was whether or not our definitions of health or our categories of health were like appropriate
Yep.
for Indigenous populations, and just sort of suggested to future researchers that they could like work on that more.
Yeah.
And then the other thing was that we were wondering about is like missing Indigenous research, because we were looking in this peer-reviewed research, which you did allude to here in terms of like looking at tribal publications possibly, or tribal, I'm not sure what you meant by that, but I'd like to know more.
Yeah. So that suggestion actually came from Dr. Kyle White, who was talking about how many times local tribal nations have their own public health departments, their own public health entities, and they actually do their own research. They will they'll publish it for their own databases, but it's not something that is put out for the public per se. It's for their own use. And so Dr. White, I think, had some connections to be able to garner some of this data from different nations throughout the states here. But we just weren't able to move that part forward. But yeah, there's I think a lot of Indigenous populations that do have this data that they're keeping themselves, using and creating themselves.
Yeah. Thank you very much for that. And what are your thoughts about the sort of categories of health and if they're sufficient or?
Yeah, after this scoping review, I definitely think I think there are differences, and that's where I was struggling a bit to know when so many of the articles came back and we're talking about holistic health versus what we see so frequently about, like what Erica was saying, is like a lot of the times diagnoses tend to be siloed out instead of looking at with this holistic perspective. But in these articles, they did talk more so about this holistic health. And I think that there are just limitations within creating synonyms and search terms that can search that complexity out. So I don't have the answer for it yet, but it's something I want to it's something that I definitely noticed and feel like we need to be able to somehow, I think a lot of it too, is related to the nature of how the mapping works within the National Institute of um, Libraries or whatever. I can't remember what the institute is called. But how that mapping occurs, I think it poses a challenge in and of itself based on what synonyms are being assigned to what.
Yes, yes. I 100% understand what you're saying and like how you suddenly find that you might exclude something by the way that you
Yeah.
set your, search terms and inadvertently exclude something rather than have it broad enough. And
Yes.
then I know like in terms of identifying indigenous populations, ours was like global, but we were kind of like, unless those articles define themselves as being focused on indigenous, then we may exclude, not categorize them as being indigenous, even if they are indigenous.
Yes.
Because maybe they don't are, I don't know, like if when you're looking globally, you might not, some countries may not have this distinction as much as we have
Yeah.
in the United States, right?
Yeah,
Yeah.
absolutely. No, I absolutely think that that is the case. And when we were, I would have to look back at my search terms, but I'm pretty sure when we did that, I think Dr. Fernandez was still on our team and had suggested actually going through and we tried to identify as many of the um, um, tribal communities that we could to try to specifically maybe we didn't. Maybe we took that. Maybe that we were thinking about but that wasn't working because then it excluded so many things. So yeah, these were the terms that we used for our indigenous people's population.
Yeah. It's just complicated.
It is very complicated. Yeah.
It was a really great discussion, and I'm just so grateful for the presentation. I want to pause in the last few minutes to see if anyone thank you so much for staying with us too. If anyone has other comments or questions you'd like to share.